guys, it's Jason from BodyWorx Physio, here today to talk to you about wrist and hand injuries. So a lot of the wrist and hand injuries we tend to treat are what we would call overuse injuries. So we see them a lot in workplaces where we're using repetitive movements. Now I guess we could probably further delineate that into two different groups. On one side we've got our hard, heavy manual labour stuff, so think about your carpenters, your plumbers, your chippies, anything that's using heavy tools, gripping, regularly hammering, heavy twisting movements. So in a lot of those patients, what we can tend to see is, just bring up my jacket, it's a little bit cold in the clinic this morning, we can either see overuse injuries in through the joints where we get early onset arthritis or stiffness, and more commonly we do tend to see a lot of our tendinopathies. So they used to be called our tennis elbows or our golfer's elbows or tendinitises. What we know from this now is we tend to call them tendinopathies. So rather than a tendinitis, which refers just inflammation, a tendinopathy refers to a degeneration of the tendon as well. So when it's acute and it's only just happened, it's inflamed. After it's been going on for a few weeks, what we do know based on studies is that we start to get a little bit of degeneration happening in the tendon there as well. So we can see that we can get a lateral epicondylopathy or tendinopathy in through the outside of the elbow, or a medial, which means on the inside. And that's just from those tendons, the common ones that come from our forearm extensors or our forearm flexors, becoming overused and getting inflamed and not getting that chance to rest and recover in between. Now, part of that is because these tendon areas have a pretty poor blood supply, and we know that the body needs a good blood supply with fresh oxygen, fresh nutrients from what we eat each day in order to heal and repair any injuries that it gets. So those are probably the two main injuries that we see in heavy workers. And so the general stretches that we recommend for those people are our forearm extensor and flexor stretches. So you can do them by holding your arm out, coming into what we call a prayer and a reverse prayer position. So to stretch out those muscles, and then also trying to unload the, you can also see there's some really good little braces that are just like an elastic or neoprene brace that just go around the top of the forearm for when you are working, and that just changes the pressure that's going into that area. The second group of injuries that I mentioned is our office workers or repetitive workers, and so they tend to be more typing related injuries. So the common things we see here are once again more aching and arthritis in through the thumb and the wrist joint. We can see increases in tendinopathies or de Quervain syndrome in the thumb, which is where the tendons of your outside of your thumb, where they go through their little sheath in the outside of the thumb here, get irritated. Also really common though in pregnant mothers, so not pregnant, recent mothers, so sort of quite soon after birth with all the handling of the baby and that, we do see this occur in mothers a lot as well. So they tend to get irritations through the tendons in through the wrist, as well as sometimes the tendinopathies that we just described with heavy workers, and more commonly carpal tunnel as well, just from the wrist having pressure or being in a compressed position. In through the base of the wrist here, we have lots of little nerves and blood vessels that run through here, and it's called our carpal tunnel because it's sort of shaped like a little tunnel and the nerves go through in underneath there. So if you're always closing down on that, it can give you problems. So in short, the quick way to deal with that usually that we start with is once again with those stretches for the forearms. If you're having problems, especially in the morning, getting a night brace, a really nice simple brace, usually the ones we sell are about $20, $30, they're not expensive, but it just holds your wrist in that slightly extended position, so it keeps that carpal tunnel nice and open. You can also wear those when you're at work. Do bear in mind though, the cheaper the brace, you'll find the bulkier it looks. If you buy a slightly more expensive brace, which are going to be about $50 or $60, they're generally a lot lower profile and they can be more easily worn at work, so you make sure you've got good position in your hands when you're typing. The other thing is to look at having like a little touchpad, changing your keyboard, and also changing how your mouse is. You can also get ergonomic mouses that help with that. So as I said, two main groups we tend to see, or maybe three if we add in the little extra recent mothers group. But we've got our heavy workers that are going to tend to be overused from all that hard gripping and using tools, our office workers, and on pregnant mums. And I guess your sports stars are going to fit somewhere into that, usually in that heavy thing, things like tennis and golf and that when we're regularly hitting it, but we often find it's because it's associated with something else as well. So I hope that gives you something to think about today. So just forearm and elbow injuries. If you have any questions or problems, it's really worthwhile getting in early. What we do know with any of these injuries is the sooner we can get onto them and get them sorted with some treatment, the easier it is to get results. If you leave it for 3 to 6 months, it's much harder as a physio when you come in to see us for us to be able to make good headway on your injury without resorting to some more significant treatments like cortisone and PRP injections, which we obviously try to avoid where possible. So hope that answers some questions for you, and if you've got any more, please drop me an email to jason@bodyworxphysio.com.au or check out our website bodyworxphysio.com.au, and you can book an appointment in online to see one of my physios. Thanks and have a great day.